It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Hey folks, what a show I got for you today. You're going to love this show, folks. I'm fascinated by it, really. I have Dr. Michael Moritz. Am I saying that correct? Moritz?
Yes, you are.
Now, this doctor, okay, does transplants. I mean, we're going to talk about kidney transplants. I know a few of my friends in the last maybe 4 or 5 years that had kidney transplants. But this is fascinating to me. And of course, he's from the Lehigh Valley Health Network. You can certainly get any information you want on all our health shows at 570-501-4LVH. Okay, so doctor, first of all, thanks for coming on the show. Okay,
My pleasure.
this is interesting because, well, first of all, tell us about who you are.
So I'm a transplant surgeon. That means I trained in general surgery and then did more time in transplantation. I finished training in 1986, so almost 30 years ago.
So why did you decide you wanted to go in the transplant area of medicine?
There was, and still is, a very inspiring surgeon in Pittsburgh, Tom Starzl, who gave a lectureship where I was doing my surgery training in 1983. And seriously, that's what inspired me to do this.
I say this is fascinating because, you know, many years ago, you know, if you had a problem with your kidney, you know, that was it. I mean, you died, okay? I mean, but the background that you have, you've been doing this for how many years? 10 years, you said, at the Lehigh Valley?
I've been at Lehigh Valley since 2005, 10 years.
Okay. But before that you were?
Before that I was in Philadelphia
Yeah.
for 20 years.
What types of transplant surgeries do you perform?
So at Lehigh Valley we do kidney transplants and we do pancreas transplants. Pancreas transplants are only for people with type 1 diabetes who are either have kidney disease or are nearing dialysis.
All right. So what is the process here? I mean, like, for example, how does one, if you're having problems with your kidneys, right? Okay, give me the typical person who would be a person to get a transplant.
So the medical specialists who take care of people with kidney problems are called nephrologists. And patients come to us either from their nephrologist or if they've progressed and they're on dialysis, from dialysis units. Those are the health professionals who refer patients for transplantation. There are other patients who come through friends and family and other referrals, but those are where most people get the direction.
Okay, so if I'm on dialysis, right, I would be a candidate. I mean, if
So who do we transplant? And
Yeah.
it's people who are on dialysis, so their kidneys have failed and they require dialysis as life-sustaining therapy, and patients who have kidney disease that's getting worse, but they're not on dialysis yet. Because the process takes time, so you don't have to be on dialysis to see us, and you don't even have to be on dialysis to get transplanted. You have to have significant kidney troubles and be headed towards dialysis, but you don't have to be on dialysis. You can avoid it if you get transplanted in a timely fashion.
is there an age factor here?
There are age factors at both ends. We'll transplant patients who are 16 years of age or older, so we don't do children. Fortunately, there are not many children with kidney disease. And upper limit is low 80s. We don't have a fixed number beyond which we won't do kidney transplants, but as we all age, there are not as many octogenarians who are candidates, say, as younger people. So it's a pretty broad array of ages. So 16 up to the low 80s.
This procedure or operation, how long does it take to do a kidney transplant?
So a straightforward kidney transplant is under 3 hours
Is that right?
of surgical time.
Now, of course, you need donors, right?
Can't get transplanted unless you have a donor kidney.
How does that work? For example, if it's in the family, mostly I guess you find that if a family member needs a kidney, then you You have to have your various tests right before.
So there are two kinds of donors. There are deceased donors, people who have died in their family or
Now,
they have chosen to donate.
Does it make any difference if the person who dies is old? Let's say there's an 80-degree or 80 person.
Sure, there's all kinds of stuff like that, but
Yeah.
but basically there are two kinds of donors: living donors and deceased donors. There are significant advantages to having a living donor. It's someone who has two normal kidneys. They've been tested. We know that they're not sick. The surgery's planned when both donor and recipient are ready, healthy-ish. And because they have the process is done on a healthy donor, the early function of the kidney is better than for a deceased donor, and the outcomes are better. So people who get a living donor kidney have better outcomes at every time point after the transplant. So there are significant advantages. Now, a living donor does not have to be related, though.
Okay. Yeah, it could be a friend or somebody else. Yeah.
Yeah, can be anyone. What kind of matching do we have to do? They need to be blood type compatible, so that can be identical or compatible. And then there's a cross-match thing. There is another type of incompatibility than blood type that we call cross-match compatibility, and that has to also be compatible.
So, what would be the risk? Because when you're talking about giving up a kidney, people, they get. I mean, you're losing a kidney. So, what would be the psychological? How do I face this? What do I look at? Is it something that is death-threatening to me if I do give a kidney up? And all these things go through my head.
So losing a kidney, donating one's a big deal. It turns out that I've been around for a while. It turns out the first living donor kidney transplant was done the same month that I was born. So that's almost 60 years of experience. So it's not something we just cooked up recently. We know from long experience, and in fact the best experience actually dates from World War II, when you had healthy soldiers who were injured in combat and lost a kidney from a combat wound, and through the VA system, they were followed for decades. So we know that, all other things being equal, people who lose a kidney live as long as people who have two kidneys. So there's no threat to one's survival because you donate a kidney.
Mm-hmm.
And so that experience is quite lengthy, and it's been reaffirmed many, many times. And sure, you have to be careful about allowing people to donate. You have to be healthy.
Mm-hmm. What has been your success rate? Oh, we talked about that before.
So with all comers, both living and deceased donors, the likelihood that the kidney's working a year later is over 90%.
Fabulous.
And there's some small attrition with time, but I mean the results are quite good.
Now, at Lehigh Valley, which first of all, we're thrilled about what Lehigh Valley Health Network has been doing. It's just fabulous. How does the transplant program work at Lehigh Valley Hospital?
So the program is under the Department of Surgery administratively. It consists of about 15 or 16 individuals, which doesn't count the nephrology group. There's a dozen nephrologists who work at our hospital who also play a major role in the program. But there are surgeons and nurse coordinators, social worker, dietitian, people who help with finance. This being America, health insurance is complicated, so we have people to help guide our patients through that process so they're appropriately insured. And so it's quite a number of people. Patients who are interested in being transplant recipients come to us. They have an education session. They are evaluated for their medical suitability, as well as the other aspects, social and financial. We encourage them to look for living donors, and if they don't have a living donor, then they'll be on the waiting list for a deceased donor. We have other niches that we look for. So there is something called kidney paired donation, which allows someone who has a living donor, but they're not compatible with that donor. So here's someone who wants to donate to them, but it doesn't work for biologic reasons. Blood type is a common reason. We have a paired exchange, so we find another pair or more than one pair of equally incompatible donors and recipients that allow them to go in opposite directions. So both donors get to donate, but not to their originally intended recipient, but both recipients get transplanted. Some of those we do internally if both recipients are on in our program, or we'll do that with other hospitals, other programs across the country.
This is, I say it's fascinating because, what you do is just amazing. I've seen, I said a friend of mine who had a kidney transplant, he wasn't doing well. Boy, after that transplant, it's like a whole new life, isn't it, doctor?
Well, why do people come to a transplant, and why do they come to us? There's sort of two broad reasons. One is lifestyle. Being a dialysis patient, and there are different kinds of dialysis. There's hemodialysis and peritoneal dialysis, and they're both life-sustaining, but they both, in a sense, have restrictions. It's a tether on one's life, how one lives, what one's allowed to do, what foods you're allowed to eat, and frankly, it's not normal kidney function. It's a subsistence level that allows you to survive. So that's the lifestyle thing. Once you get a kidney transplant, sure, you have to take pills, you have to come see us, you have to get some blood tests periodically, but there are many, many fewer restrictions, dietary, activity, otherwise. That's the social reason that all our patients can appreciate. The more subtle one is people with a transplant live longer, at least those under age 75, will statistically live longer with a transplant than they would on dialysis. And medically, that's a very compelling reason to seek transplantation. Who doesn't want to live longer?
Folks, I'm talking to Dr. Michael Moritz, Chief Transplantation Surgery at Lehigh Valley Health Network. I tell you, this is fascinating stuff. No reason to suffer out there today, folks. If you want information, it's 570-501-4LVH. Remember, all of these shows are on our website. Go to Lehigh Valley website, and you'll see, get information. We'll be back right after this. Welcome back to the Sam Lesante Show, folks, part of our health shows from the Lehigh Valley Health Network. Remember, you could watch all of our shows that we produce here at ssptv.com. My email is sam@ssptv.com. My guest today is Dr. Michael Moritz, who is the Chief Transplantation Surgery at Lehigh Valley Health Network, and we're talking about kidney transplants. Now, what we talked about why a person should be suffering. There's no reason why they should be suffering. However, there is a process you have to go through. Okay, so what would be the process for a patient to receive a kidney transplant? I think we covered that, but just to review that.
So someone who is interested in exploring transplantation calls us, and we'll arrange for them to be part of an education session. Those are taught by one of our staff. They're typically anywhere from 3 to half a dozen patients and their families who attend to provide some of the same information we're talking about today, and to help patients make an informed decision about whether transplantation is something that works for them. Assuming that it does, then they would come to see us or any other kidney transplant program for an evaluation, which is much more focused on medical aspects of their health, as well as social aspects and a bit about their insurance, to ensure that, again, everything is right for them. So that's how recipients get into the mix. For individuals who are interested in potentially being a living kidney donor, that starts with a phone call. And there's some basic screening, because while it's true that a living kidney donor does not have to be perfectly healthy, they can't have anything that's going to impact kidney function. So if someone were to call and say, hey, listen, I want to donate, but I have diabetes, we would say no, politely, because diabetes does cause kidney disease. Likewise, if a woman has had multiple pregnancies and has had what's called gestational diabetes, which is diabetes while you're pregnant, they're at risk for getting diabetes in the future, and they shouldn't be allowed to donate either. So we would let them know that that's not the right thing for them. And so assuming that someone passes the screening, we would then find out what's their blood type, what's their kidney function, and move on through their medical history and evaluate them as potential living donors.
There are some people, and a friend of mine, okay, a very good friend of mine, years ago, I would say maybe 4 or 5 years ago, he just wanted to donate a kidney. He didn't know where it was going to go, but I mean, some people just want to help save other people's lives, all right? And I think that was very admirable of the person. He just wanted to give a kidney. So what do you do if someone says, look, I think I have 2 healthy kidneys, you know, God gave me 2, I think I could save someone's life if I give my kidney up? You know, what do you do with that kidney?
We have a name for that. We call them anonymous donors. If they want to donate and help someone else, that's fabulous. They're not doing it because they want a new best friend. They're doing it because they want to help someone.
Exactly.
So while they may or may not meet the recipient afterwards, they're not going to meet beforehand. This is an anonymous gift that they choose to give. And we hold them to the same standards. They have to be reasonably healthy. It can't be a threat to their well-being.
What do you do with the kidney, though?
So we would basically allocate the kidney to the patients on our list, usually on our list, using the national criteria. It's a point system, who's been waiting the longest, et cetera, et cetera. So that's how we would deal with that. Now, if someone says, hey, listen, not only do I want to help one person, can I start something that would help other people? Can I donate to someone who's got a living donor they're not compatible with, and that donor can donate to somebody else, et cetera? And then those are called chains. And the answer, of course, would be sure, we'd be happy to. So a donor who comes to us and is willing to donate, if they're willing to let us drive the process, then we'll arrange for them to become an anonymous donor that starts a chain that uses kidney paired exchange to help other people, to magnify the impact of that gift.
So if I have a healthy kidney and I really want to help somebody, but let's say I want to help somebody who has a family, okay, a father or a mother, you know, just so they could enjoy their family. I could specifically say, look, Dr. Moritz, I'd like my kidney to go to a person who has a family, or can I designate where I want my kidney to go?
No.
Oh.
You can.
There you go.
You can designate, and the same thing's true, by the way. It's the same rules as for deceased donors. So if someone dies and the family is opting to donate their organs, they have some leeway. They can say, look, I would like someone to get transplanted at this program.
Okay.
But you're not allowed to say, I want a certain age, or I want a certain gender, or a certain ethnicity.
Okay.
No.
You just
I just want to help kids. No,
Yeah, okay.
you can't
do that.
stipulate that. You can say, listen, you all have a national system. Everybody's agreed on it. This is how we allocate organs. I'm willing to donate by those rules. Fabulous.
Okay, now you did say it's about a 3-hour operation, right?
For the recipient.
The recipient. How about the person who wants to donate a kidney? I mean, what is the hospital stay? Was there any medical things you have to go through? Like, what would be the whole process here?
So there's a whole workup that you're not allowed to donate if you don't have 2 healthy kidneys. Right. So all that it takes to establish that fact has to be done. The imaging is done by CT scan, so there's no more intrusive stuff like back in the old days. To look at the defined anatomy of the kidneys, right, left, how many arteries, how many veins, which is suitable, or both, to donate. It's a minimally invasive procedure, meaning it's done laparoscopically. There isn't an incision, because you have to pull the kidney out intact, obviously.
Yeah.
Hospitalization 2 to 3 days. Return to work starts at about 3 weeks, depending on the kind of work you do.
Is it a painful procedure?
It's uncomfortable, sure, for at least the first week. Yeah, the incision to pull the kidney out
I
hurts.
mean, you survive, but I mean, it's
Oh,
something.
yeah, it hurts. We provide a variety of things to eliminate the pain.
I'm going to break. When I come back, I want to find out what would be the typical. If I called, your hospital, and what would be the wait time, folks? I'm talking to Dr. Michael Moritz. I tell you, this is a fascinating show, folks, about kidney transplants. He is the chief transplantation surgery at Lehigh Valley Health Network. This hospital is just fantastic. We'll be back after this break. Welcome back to the Sam Lesante Show, folks. My guest today, Dr. Michael Moritz. He is the chief transplantation surgery at Lehigh Valley Health Network, and we're talking about kidney transplants. What would be the wait time, doctor, to get a kidney transplant?
So there's a national wait list, has about 100,000 people on it.
Oh my goodness.
It's broken up into a lot of different things, regions and localities, et cetera. It gets pretty complicated. And so there are certain levels of priority, so you can get picked out of turn. But having said that, nobody knows if you're going to be special tomorrow. What's the average wait? Average wait's over 4 years.
4 years.
In Pennsylvania. So both of the localities in Pennsylvania, and local is by the Organ Procurement Organization, are about the same, about 4 years. New Jersey, approaching twice that.
Now,
Just for
but if you have a donor, you're okay.
Living donor doesn't. You're not waiting in line.
Right. Okay. What are the different programs that Lehigh Valley has?
So we have a kidney transplant program for people with kidney disease, and we have a pancreas transplant program for type 1 diabetics, nearing or on dialysis, or who have a living kidney donor. So they get a living kidney donor and then wait for a pancreas. There are other transplant programs around. We think that what distinguishes ours is our focus on transplanting as many patients as possible, meaning that we consider ourselves to be very liberal in donor selection and recipient selection. So we're looking for people who can benefit. We're not looking for people like us. We're not looking for people who are skinny or whatever. We don't have those criteria. We want people who we can help. And likewise, we've done a lot of work over the years on utilizing some of the deceased donors that other programs cannot or choose not to increase the number of people who can benefit. Every program in the country's outcomes are available on the internet through a website, srtr.org, and you can look up every program's outcomes. And outcomes is not just what happens to people who get transplanted. It's how long are people waiting? What's the average wait time at Lehigh Valley? Compare it to the other programs around, as well as how long people live and how long the kidneys work. So that's all available on the internet. It's updated every 6 months. And so it's easy to do comparison shopping. So we know how we rate compared to our local and national competitors, and we do very well. Particularly at the rate at which we transplant people.
Well, I think your team is so very, very valuable to you as well, right?
Well, the program goes back over 20 years. We've done over 1,000 transplants. We did our 1,000th transplant right before Thanksgiving last year. So what does that mean? Well, it means that if you're our patient, you're not dealing with a bunch of people who are inexperienced.
Right.
You're dealing with people who are pros. This is, for the people in the program, this is all they do. And they get pretty good at it.
I think it's fascinating, I really do. I would encourage you folks, if you have two great healthy kidneys, there are a lot of people that want to help other people out. Or if you have any concern about our discussion today, our kidney transplants or the procedure or anything that you have, it's 570-501-4LVH. It's the Lehigh Valley Health Network, second to none. Doctor, thanks for coming on the show.
Sam, thanks so much for having me.
I find this, I'd like to continue talking about your different transplants, but I think what we have available to us today and good people like you, it's fabulous. Okay?
I really appreciate that.
You're watching the Sam Lesante Show. Remember, 24/7, you watch all of our health shows. But once again, if you have any questions at all for Dr. Moritz, call him at 570-501-4LVH. We'll see you next time.